Today, we have a very interesting segment planned for you all. We've invited 3 special guests to talk about the upcoming movie, Infected. Before we begin, here is a trailer of the movie. Wow, I definitely have to watch that movie. 1/3 of the world's population, that's about 2 billion people who are potentially infected with TB. In today's segment, we'll be discussing this horrific disease. Before we begin, here's a bit of background about the disease. TB is an infectious disease caused by the bacteria Mycobacterium tuberculosis. It can affect almost any tissue or organ of the body, but the most common and often the first organs to be affected are the lungs. Tuberculosis spreads through the air. This disease is contagious, which is why it has impacted so many people around the world. To give us all a detailed outlook into the disease and the bacteria, please welcome our first guest of the day, Dr. Renota. Hello, Dr. Renota. How are you doing today?
Quite fine.
Please have a seat.
Thank you.
We'll also be talking to 2 other guests today. Unfortunately, they couldn't be here with us, but we have set up an online webcam. So, please welcome Dr. Dollywall and Dr. Van. So, welcome to our show. How are you 3 doing today?
I'm doing well, thank you.
We're very excited to be on the show.
Well, that's great. So, given your medical background, what are your thoughts on the upcoming movie?
The movie is very informative and it's an accurate description of people living in third world countries.
Well, all the facts presented in the trailer are true. Tuberculosis is a widespread pandemic that continues to impact many countries around the world.
In the past years, we have seen some terrible outbreaks of the disease, such as in the late 1800s, where 1 in 4 individuals in Europe and America were killed due to TB. Now, as the dangers go to third world countries, it is very important not to just treat, but also to prevent such outbreaks.
I absolutely agree with all of you. So, Dr. Dollywall, how does a person get infected with TB?
Tuberculosis is contagious and spreads from person to person through tiny droplets released into the air when we talk, breathe, cough, sneeze, or sing. A person can become infected with tuberculosis bacteria when he or she inhales minute particles of infected sputum. You don't get TB by just touching the clothes or shaking the hands of someone who is infected. Tuberculosis is transmitted primarily when a person breathes infected air during close contact.
This is why cleanliness and hygiene are so important. If we were to regularly wash our hands and minimize the number of times we touch our faces, then we would all have a much lower chance of catching such infections. So, once a person has been infected, what are some of the effects of the infection?
When a person becomes infected with tuberculosis, the bacteria in the lungs multiply and cause pneumonia along with chest pain, coughing up blood, and a prolonged cough. Other symptoms include fever, losing weight, and feeling weak.
Do the symptoms surface immediately after transmission, or can the bacteria remain dormant?
Most people who become infected with the bacteria that causes tuberculosis do not develop symptoms of the disease. This is known as latent TB since the bacteria is alive in your body when you're growing.
Why does the bacteria choose to infect the lungs?
MTB is an obligate aerobic bacterium, meaning it needs oxygen to survive. For this reason, MTB and the TB disease are found in the upper air sacs of the lungs. MTB is a small, slow-growing bacterium that can only live in humans.
The bacteria and its functions obviously have a lot to do with the effects of the disease. What are some of the basic characteristics of Mycobacterium tuberculosis?
Mycobacterium tuberculosis is a rod-shaped bacteria. The rods are 2 to 4 micrometers in length and 0.2 to 0.5 micrometers in width. They are classified as acid-fast bacteria due to their impermeability by certain dyes and stains.
I have heard that the cell walls of bacteria are a very important aspect. What are some characteristics of the cell wall of the bacteria?
The cell wall structure is unique among prokaryotes and is a major determinant of virulence for the bacterium. MTB is not classified as either gram-positive or gram-negative because it does not have the chemical characteristics of either, although the bacteria does contain peptidoglycan in their cell wall. If a gram stain is performed on MTB, it stains very weakly, gram-positive or not at all, where the cells are commonly referred to as ghosts. Over 60% of the mycobacterial cell wall is lipid.
Can its effect be hindered by antibiotics?
As a matter of fact, this bacteria is highly resistant to typical antibiotics, acidic and alkaline compounds, and lethal oxidations and survival inside of macrophages due to the lipids.
The upcoming movie seems to be targeting the prevalence of tuberculosis in third world countries. Why is this disease more common among these nations?
Individuals living in third world countries are at high risk due to the lack of proper medical care, unhygienic living conditions, and the prevalence of poverty. In 2011, the largest number of new TB cases occurred in Asia, accounting for 60% of new cases globally.
As you all can see, tuberculosis is a very serious, fast-spreading pandemic, but it can be treated. Whereas developed nations have access to proper medical treatment, third world countries are left suffering. For more information on the outbreak of TB, remember to watch Infected when it comes to theaters on March 8th. Thank you to all our experts for being on the show today.
Thank you for having us on the show.
And for you viewers, remember to tune in next week for another episode of World Issues.